So is there a technological solution to all of this, Jonathan?
So I'm proud to work in the NHS and everything it stands for, but I am worried about its future. And just now and probably over the weekend, you've heard about those challenges and the potential solutions. But I'd argue that the only solution that's going to give us a sustainable NHS as we know it is a digitally enabled NHS. And you might argue that, well, we've tried that before and spent billions of pounds and failed on epic proportions with the national programme for IT, and you may be partially right, because the evidence suggests that the widespread kind of adoption of electronic patient records has actually decreased efficiency rather than improved it. But actually, I think this, as people are calling it, first wave of technology has been really important to kind of digitise existing records and processes. And when you think about it, it was a massive infrastructure project to give everybody in this country an electronic patient record. And so maybe £12 billion wasn't enough when you think a train line from London to the north is going to cost the country £25 billion. But you have to think about why haven't we delivered those improvements with that massive investment? And I think it boils down to the fact that the technology doesn't yet provide the workflow tools for both patients and healthcare professionals to drive up the quality and efficiency of the service. So, we've probably all had experiences as patients around, wanting to book an appointment, and we'd normally do that online to our convenience rather than just being given an appointment whenever the health service feels like it's appropriate. Or we may want some reassurance because we've got a rash and we get diverted through various switchboards and then end up in an emergency department waiting to see a doctor for 4 hours. Or we all expect that all our doctors and nurses see the same information, so we don't have to continuously repeat ourselves time and time again. And I'll give you a little bit of a flavour of what it's like as a frontline healthcare professional, and you may wonder why I brought this with me. I was just wondering, is there anyone in the audience who's under 25 and not involved in healthcare and knows what that is? Anybody? You see? Anybody under 30? Just pass that around, because that there...
Peter doesn't know what it is.
So as a frontline healthcare professional, this is how I coordinate care, so with paper and one of those. So, yeah, it's a pager.
You're still using a pager now?
So that's the mainstream form of communication in the majority of hospitals in the 21st century. So we often play ping-pong pager, where I waste hours of my time trying to refer patients to other specialists, get their input. This is the list of patients, who they are, where they are, all the tasks that need to be done. And believe it or not, I still have to regularly use a fax to send information to either another service or primary care. So imagine if you booked a round-the-world ticket and then you found out that your flight was being coordinated through a pager and a fax machine. How safe and efficient would you think that service is? And also, if you think about, when you were going to do something, book an appointment, or for any other company, would you tolerate having to communicate via letter or not being able to book an appointment when you want it? But that's the reality in healthcare at the moment. But every other high-risk industry in the world's revolutionised itself through technology and information. And so I haven't quite worked out why we all tolerate the fact that we use this archaic technology in healthcare, particularly because we all know that the world's moved on dramatically in the last 10 years. And also that there are pockets in this country and internationally where people can book online. They can have direct access to their primary care or hospital specialist, and sit in their own homes and be monitored. But luckily, this kind of second wave, as people are calling it, of healthcare technology is coming, and it really is focused around solutions to patients' and healthcare professionals' needs. But can we be sure that actually this is going to happen and it is actually going to work? Well, I don't think we can be absolutely sure, but I think there are some positive signs. So, for example, NHS England has ring-fenced billions of pounds again to improve the digital maturity of our healthcare organisations. And I do actually think they've got some of their strategy right around open data, transparency, setting standards around interoperability so different systems can talk to each other. There's a really important program that's on hold at the moment called Care.Data, and you may well have heard about it because it's got some bad press recently, but that's around kind of combining hospital data with primary care data. We already collect a lot of hospital data, and in fact that's what was used to identify the mid-staff scandal. And it's got bogged down in lots of issues around privacy and security, but I actually think that might be one of the most important things this country's healthcare system actually does since the kind of the discovery of penicillin. And what other things are going on? Well, there was a recent journal published showing a hospital had reduced its mortality by 10% just through the introduction of digital observations. So this kind of stuff's an absolute no-brainer for me. The primary responsibility of a hospital is to identify people who are sick and deteriorating and intervene earlier, and kind of paper and pen don't really cut it. And there's a guy called Ali Passar, who you might have also heard of. He was the founder of Circle. So they were the first private organisation to take over an NHS hospital, Hinchinbrook. But he's just set out on a new venture, a company called Babylon, which is, really it's a doctor in your pocket. So through one of these, you can kind of get in contact with a doctor at your convenience and organise your whole healthcare through one of these devices. There's also been clinical trials showing that the improved management of diabetes through far better self-management through the use of apps on mobile devices. And there is some really, really interesting and innovative stuff happening in this city, in Bristol. There's a big project called Connected Care, which miraculously has managed to start integrating data from across with primary, secondary and social care across the city. So in the near future, we might be in a position where all healthcare professionals and also hopefully patients can see the same information, so we don't have to go through that rigmarole of telling doctors and nurses the same information time and time again. In the intensive care unit in Bristol Royal Infirmary, who looks after some of the sickest people in this city, they've had an electronic patient record for well over 6 years now. They've got millions of hours of data, and they're using that data to drive up the reliability, performance and safety of the service they provide to those critically ill patients in the city. And internationally, billions and billions of pounds have been ploughed into health IT companies, small and large. And the biggest technology companies in the world, Apple, Facebook and Google, all in the last kind of 6 months have announced their kind of move into healthcare. And they're not going to wait for the NHS to get its act together. So the NHS really needs to step up and take a lead in this. So I haven't really talked much about the kind of issues of security and privacy, and I'm not really going to dwell on that. They are important, but my view is that we can't let the risk of some evil kind of detract from the massive improvements that could be gained from the widespread adoption of technology in the health service. So I actually think the future's bright. I think there's going to be some incredible things that happen that are technologically enabled over the next 10 years. And I think it's really crucial that the public and healthcare professionals support, encourage, demand and hold healthcare organisations to account so that they do become digitally enabled. And as an example, why doesn't every healthcare organisation in this country have an IT director or CIO sitting on the board of the organisation? This is the 21st century. If we are be able to do this, and I think we can. I think we can really cement the NHS as the best healthcare organisation in the world.
Thank you.